Hello, this is David Lee from Prevent Connect, and welcome to today's Prevent Connect web conference, Going Beyond the Individual, the Evidence Supporting Multi-Level Adolescent Dating Abuse Prevention. Thank you for joining us. We have people from all over the country joining us on today's conversation. I'm really glad to be able to have so many of you coming to be able to participate in such an important topic, highlighting some of the new research that's been out there. So our objectives today are ambitious, but I think important, is that we're hoping that you're going to be able to summarize the research evidence that examines the association between neighborhood-level factors in dating violence among adolescents and emerging adults, identify some of the contextual factors that influence the likelihood of substance use-related dating aggression, discuss the implications, the association of societal-level indicators of gender inequity with the prevalence of adolescent dating abuse, and propose some novel approaches to how we can be able to preventing dating violence that integrate the results of this field on the outer levels of the socio-ecological model. So I think this is an important topic that we have here. And as we know, teen dating violence is an important topic. We see that there is Teen Dating Violence Awareness Month is in February, and every year now the president has been putting out a proclamation around that. And for purposes of this web conference, though, we're going to be using, you'll be hearing researchers using a slightly different term than teen dating violence. That's one term we're going to be using, and now I am totally forgetting what my title was that we're going to be that we're using for this.
Adolescent dating abuse. Yeah, adolescent dating abuse.
Adolescent dating. Thank you. There are many terms that people use, and there's reasons for them. We're not going to go as much into what those reasons are, but we want to be able to highlight that theme as this topic comes up. We are not going to go through all the epidemiology about how much teen dating violence takes place. This is an audience that's very aware of it as people that are practitioners in the field, and there's many great resources. What we want to do is think about how we're going to move to the next level of conversation to be able to move forward. And the way we're going to do it is we're going to be looking at the socio-ecological model and thinking about how we can be able to do prevention work in a way that's going to focus on the outer levels, the societal and community levels. So much of our work has been done on the individual or relationship level in our classroom presentations and pieces, and we're really trying to focus on how we're doing that, but yet one of our gaps is that we don't have as much research on this topic. And so what we're going to be doing today is showing some of that research that's available to highlight what is happening on this. So this I'm sure that, how many of you are familiar with the socio-ecological model? Just go ahead in the left-hand corner, just say yes or no if you are familiar or not with this model of the socio-ecological model. I am willing to bet that we have an audience that's very familiar. I'm going to share the results, and as you can see, our audience is predominantly available. I do want to ask a couple questions just before we go, just to know who's in the audience. So the first question I want to ask is, have you attended a web conference before today? So on your screen you should see 4 options, and go ahead and click the one that is this the first time you've ever been on a web conference in your life? Have you attended web conferences before, but the first time attending a Prevent Connect web conference? Have you attended 1 to 2 previous Prevent Connect web conferences, or are you a regular and have gone to 3 or more? And I'm going to share the results, and just so you can see that 21% of you are new to Prevent Connect. I hope you find this very helpful as a way to have a conversation. And as you can see, over 53% of our audience have been, including 37%, have been on many Prevent Connect web conferences who are very familiar with the work that we're doing. I'm going to withdraw that question and just get a sense of who's in the audience. And so you're going to now see a list of types of organizations. So I want to see what organization best describes who you are. So go ahead and look and pick the one that best fits your organization. I know that it's hard to be able to find these, and a few of you will be picking other, but which one best? I'll keep on voting. I'm still seeing many people have not voted yet as you are looking at the list. And what we're going to see is that 21% of you are from dual sexual violence domestic violence agencies, another 16% from domestic violence agencies or coalitions, 6% from sexual assault, 5% from college or university, 2% from K through 12 education, public health department 6%. We also have people from community-based organizations, criminal justice, state, territorial or federal government, child abuse and child maltreatment, mental health, and health care. So thank you all for doing that. I'm going to close this, and I see many people joining us. So with this, I want to ask a question of our audience, and this we'll be doing a lot, is when we talk about doing, as here, these are not easy to do. So what are some of those challenges to implement community and society level interventions to prevent adolescent dating violence? What are some of those barriers? Sarah says lack of funding as one of them that comes up, and I think that's one that we see often, is the lack of funding that makes this more difficult. What are some other ones that are going to become barriers to challenges of why it is hard to be able to implement? So I'm seeing providing, how do you get multiple exposures to get maximum learning outcomes, small communities with their own needs and values, not wanting to talk about adolescents about sex. They want to focus on at-risk youth instead of doing population-based work, lack of understanding of the community, lack of policies that protect teens. Parents don't look at their teens through these lenses. People really request things on an individual level, adultism, lack of community readiness or buy-in, not getting the exposure to school, hard to get access to the community outside of school, hard to get in schools because there's so much space, parental consent. Teenage violence is one form of violence. We need to address the interconnections of them. Schools aren't comfortable with sex-positive sexual assault and domestic violence education. Faith groups may resist the idea that IPV takes place within their community. A country with over 1 million residents, they're in a county with over 1 million residents, only one full-time person directed to address teen dating violence prevention. Hard to get into schools. I see a lot of challenges that we see. One of the challenges that I see also is that we want to be able to base the work we're doing on what we know works. Yet we have very little evidence and research that indicates what's doing that to define that work. And that we want to be informed by our experience and also by that research, but we don't have enough of that within our communities. So that's one of our challenges that we see. And so what we want to do is find a way to be able to help strengthen that. So in this, I was very excited when I was talking with Emily Rothman, it was probably earlier this year, about a journal that she would edit of the American Journal of Preventive Medicine, looking at the theme beyond the individual, family, neighborhood, and state level influences on dating violence. And when Emily told me that this was coming out, I think I said instantly, we need to do a web conference on this. It's an important topic, and that this came out in the September 2015 issue, and so I do encourage people to check this out with these articles. There's many articles. Here's just a list of the titles of all the articles that you can be able to see, and we will be talking about three authors of these articles, not all of them, but many of these articles, to be able to get a sense and share some of those findings with you today. So with that, how many of you have read any of the articles in this issue of the American Journal of Preventive Medicine? So let's go ahead. If you've read any of the articles, let us know and go ahead and vote. And I know they're a little hard. I'm sharing the results live, so I'm seeing overwhelmingly people have not read them. They're a little harder to get access of because you do have to pay for them. One of my hints on getting articles is often contacting resource centers who are often able to get copies of them, contacting authors of the articles. They're very willing to share, or finding people at the university who have access to articles to be able to get those. So about 89% have not, 11% have read the articles. So thank you so much for sharing that. I'm going to clear that result and withdraw the question right now. So with that, I want to introduce our guests today who are joining us. I'm really pleased to have this group of presenters. So we have Lindsay Gressard, who from the Georgia State University School of Public Health. Hi, Lindsay, are you here?
Yep, I'm here.
Great. So glad. How are you doing today?
Great, great. How are you?
Wonderful. We also have Renee Johnson. Are you on the line? You might have to press star.
I'm here. Really?
Hi, Renee. You got here. Wonderful. And Renee is with the Johns Hopkins Bloomberg School of Public Health. Thank you for joining us, Renee. We also have great. We also have Luz McNaughton Reyes, who has been on a previous Prevent Connect web conference. And glad to have you returning back again, Luz. How are you doing today?
Thanks, David. It's great to be here.
Wonderful. And we're also joined by Emily Rothman from the Boston University School of Public Health. Hi, Emily. How are you doing?
Good, great.
Great. Well, thank you, and I'm really glad that you're taking the time to be able to share the results of your work. Often when we see academic journals out there, as you can see, not many practitioners often get a chance to read the articles, yet these articles I think are so important to influence our practice. And so that's why I'm really pleased that you're going to be able to share some of the findings and be able to have this discussion about the implications for prevention. So I thank all of you for joining us today. So as we said, we're using this socio-ecological model, so this is part of what we'll be thinking about, just so we have that present here. And so I want to turn the podium first over to Emily Rothman, who is one of the co-editors of this edition of the American Journal of Preventive Health. And Emily, I'm going to give you the podium so you can advance your own slides and maybe talk about why you were editing this issue and why it's an important topic for all of us to listen to.
Okay, great. Thanks, David. So I was really happy when folks at the CDC told me that they were putting together this issue and wanted to think collectively about what does it mean to do dating violence prevention work at the outer layers of the social ecological model. And part of that is because I know that for activists or advocates and people in the field, the idea that where you live or the context that you're in matters when it comes to violence or dating violence perpetration is a no-brainer, that makes a lot of intuitive sense to people. And yet, the part that I think research can add and that we can learn from it is exactly how is it impacting people and what little sub-pieces of it could we do something about? So it's almost as if someone said, oh, you know, food impacts your health. And we all say, of course it does. Of course what you eat impacts your health. But to dig a little deeper and say, well, you know, how exactly does it do that? And what should we be doing in response? Let's refine this and get a little bit more specific. I think that's what the people who are presenting today have to offer, so some more specifics. The other thing that I wanted to tell you before they present is I think sometimes in the field it's hard to picture, well, how can we do things at these outer levels? And for some of the reasons that everybody was talking about, from funding to people in the community not necessarily being on board with some of the ideas. So just to give a little hope and a little inspiration, I wanted to share one of my favorite community efforts that's going on. So Jessica Walsh is a prevention specialist in domestic violence that I met through the Delta program that people may know about or remember, which is a CDC-funded initiative to prevent domestic violence through primary prevention. And Jessica became really interested in this idea of, well, neighborhood collective efficacy is important too, not just individual behavior. And so she started thinking about what could I possibly do that actually improves an entire neighborhood's collective efficacy? I mean, how do you take that on? And Newport isn't huge, and their resource center didn't have a ton of money. So what she decided to do was, I'm going to get together with other people who share concerns about youth in our city, and they decided to have the kids all come together to paint a mural. And the mural wasn't about dating abuse overtly, but it was the fact that people were getting together. They were able to hold side conversations about dating abuse when they were painting. And they were also able to create just that underlying feeling of we're all working together to improve our neighborhood in some small way. That really has, at least anecdotally, felt different to Jessica in terms of how kids are relating to each other, and a real positive. I know that Jessica and Lucy, who works at the Rhode Island Coalition Against Domestic Violence in charge of prevention, also gave a podcast on this topic through this Prevent Connect, and so people can find out more about that if they want to hear. And there's other ways besides getting people together to do, neighborhood cleanup or mural painting or other things like that. So changing social norms is something that we talk about a lot, community norms. And, there are some social norms campaigns that are more successful than others. This one I just put up as an example because it seems somewhat innovative and like it could capture people's attention. So I don't know how they've done it, but the more people that look at this billboard, the more this woman's face changes into like a healed face. So if I back it up, you can see that she like has bruises, but then as people walk by and look at it, she gets better. So, there's lots of different, I think, really imaginative and creative approaches that people can take to trying to inspire people in communities to start conversations and think about what they can do. So if you're sitting there and as you're listening to this podcast, you're thinking, all right, I'm sold. I'm believing that neighborhood matters and these specific parts of, the neighborhood context matter, or substance abuse matters in this way, or gender inequality. What is it that I can do at the outer layers? What does that really mean in real world terms? So put together, this list of 6 things that you can think about doing in combination with each other or individually. So of course, you can try to change laws and policies. That is working at the outer layer. You can go to specific workplaces or schools and work on their policies and procedures. Building neighborhood coalitions, and this is one that I would really encourage people to think about. It's like the mural painting thing that Jessica did in Newport, which is even if you aren't talking overtly about violence prevention at all, working with other groups in your area that are simply trying to improve the togetherness of people in the neighborhood, that, according to research, we think could boost, any kind of prevention effort, or may actually have a helpful impact on dating violence or violence more generally. So worth considering doing. Then, of course, there's all the educating of people who are in the systems that you're trying to work with, community education forums, which I know a lot of people do, and community campaigns. So just to give a sense that when we're talking about the outer layers, these are basically the things, at least that I could think of, that I would say, count, or that you could try if you want to work on these issues. That's me.
Great. Well, thank you so much, Emily, for giving that orientation. So what we're going to do is we're going to go through 3 different papers that we've discussed and be able to do this and have opportunity here. I've been putting links into the chat, and you can also get copies of the slides on the Prevent Connect website where you can get some of the links. So we're going to start with Lindsay Gressard, who is with Georgia State University, and she is going to, her presentation on is gender inequity a contextual risk factor for dating violence? So Lindsay, this is a great topic. I'm really glad that you're sharing the findings of your work.
Great. Well, I'm excited to be here. You can hear me, right?
Perfectly.
Make sure I'm not on mute. Great. Okay. Perfect. All right. Yes. So as David mentioned, I'm Lindsay Gressard, and I'm from Georgia State University, and I'm super excited to be here with everyone today and to be able to talk about the study that my co-authors and I did to find out whether gender inequality could be one of those factors on the very outside edge of the social ecological model that is associated with dating violence. So if you remember the model that David showed, we're looking at the very outside ring of that model. So we're not looking at gender inequality within a relationship or within an individual relationship. We're looking at it in society and whether that's something that can influence dating violence. So before I get started, I do just want to acknowledge my awesome co-authors on this study, Dr. Monica Swan at Georgia State and Dr. Andrew Tiedenkart at Centers for Disease Control and Prevention. Okay, so first, I just wanted to give you all a little background on why we decided to even try to look at risk factors at the societal level. So, as I'm sure everybody is already aware, we know that 1 out of 10 high school students has been a victim of adolescent dating violence. And that number comes from the Youth Risk Behavior Survey, which is a nationwide survey of high school students that's conducted every other year. And it asks students about a whole variety of risk factors, anything from drinking alcohol to risky sexual behaviors to texting and driving, and of course to dating violence. So we all know the statistics, but one thing we were less sure about is whether this is true for every state and whether dating violence rates may vary across states, and if they do vary, what is causing that variation? So fortunately, the Youth Risk Behavior Survey has a really sophisticated sampling methodology, and that lets us get a prevalence rate for dating violence that is representative of the entire state. So we were actually able to look a little bit closer at this. So what did we find? Well, as it turns out, there actually is some variation among the states. So some states, like the ones highlighted here in blue, actually have a lower prevalence rate than the national average of about 10%. So as you can see, Utah has the lowest dating violence prevalence rate at 7%, which is then followed by Vermont at 7.4%, and then Nebraska, Kansas, and South Dakota round out the 5 states with the lowest prevalence rate. And then on the other hand, we also have states that have a higher prevalence rate of dating violence. So here you can see in red the states, the 5 states that have the highest rates of dating violence, with Louisiana being the highest at 14.8%. And then just to complete the picture, I've filled in the other states, and the ones that are in light blue are any of the states that are below the national average of 10% dating violence prevalence, and then the ones in light red are the ones that are above the national average of 10%. And I'm sure you'll also notice that there are some states that are still white, and those are the states that actually don't have state representative data for this measure. So they either just don't participate in the Youth Risk Behavior Survey, or they don't have state representative data for the survey, or they may have actually just omitted the dating violence questions from the survey.
Lindsay, 1 second before you go on. A little clarity. Some people are not familiar with this survey, and okay. The answer that. So, can you just describe how this is how the Youth Behavioral Risk Survey is done? On is it an anonymous? Is this reports or a survey of people, and what type of question is being asked around dating violence?
That is a great question. Yes, of course. So the Youth Risk Behavior Survey, it is anonymous, but it is taken in school, and it's a paper questionnaire where they self-report their behaviors on a variety of behaviors that I mentioned a few examples of. So physical dating violence is actually measured by just one question, and that question is, in the past 12 months, how many times did someone you were dating or going out with physically hurt you on purpose? And then it gives examples, which are being hit, slammed into something, or injured with an object or weapon. And then for the survey, for the prevalence rates that they obtained that are in this map here, they actually broke that down into anybody who said yes, that had happened more than once, or one time or more, and then the people who said no, that had never happened. Okay, and then there is one, oh, sorry, go ahead.
Go ahead.
Okay. And then there is another question that actually asks about sexual dating violence, and that is, the question is, in the past 12 months, how many times did someone you were dating or going out with force you to do sexual things you did not want to do? For example, kissing, touching, being physically forced to have sexual intercourse. So those are the 2 questions that were used in this study.
Right. And for this, you looked at state data, but there is, of course, data that is more, can be reached, as someone already highlighted in here. You might have a state data, but you can also get more localized data, too, depending on
yes,
where.
Yes, you can. Yes, it just depends on Some states will give that information broken down by city, but others will not. And then, of course, others do analysis using individual reports on the survey. Okay. So after we saw that there was definitely variation among the states, this really made us wonder why and what was driving this variation among the states. So first we looked into the research to see whether there was anything done that looks at different societal level influences on dating violence. And basically the shelves were pretty empty. So there wasn't a lot out there that looked at contextual factors that influence dating violence. But then we knew that gender inequality is something that has been looked at in relation to just relationship violence in general, and especially violence against women. So essentially, research has just shown that societies in which women have less political or economic or social equality, in those societies, the rates of violence against women is going to be higher, specifically in their intimate relationships. So this just made us wonder whether gender inequality could be connected to rates of violence among adolescents as well. But of course, the main issue there is first you have to figure out how you're going to measure gender inequality, which is sort of this nebulous construct. So we had to figure out how can we get a hard and fast number that represents gender inequality. So fortunately, the United Nations Development Program has actually developed an index of gender inequality in their Human Development Report. And in that report, they gather data from all different kinds of sources from different countries around the world, and they create a number of different indices. So they have an index that measures the level of development in a country. They have an index that measures the level of poverty in a country. And now, recently, they've added an index that measures the level of gender inequality in a country. So they have basically decided that gender inequality is made up of 3 different dimensions. And so the first is reproductive health and whether women are able to access reproductive health resources. The second is empowerment, and that's looking at empowerment of women versus men. And then the third is labor market participation, and that's looking again at the comparison between men and women. And so those 3 dimensions are then further broken down, as you can see in the lower row, into 5 different indicators. And these are the indicators that they get data for that is used to measure each of those 3 dimensions of gender inequality. So the first indicator is the adolescent birth rate for each country. And then there's the maternal mortality rate for each country. And then within empowerment, you have female government representation versus male government representation. And then again, you have female educational attainment versus male educational attainment. And finally, for labor market participation, there's just one indicator that they use, and that is how many females are participating in the labor force versus males. And that's based on the number of people who are currently employed and the number of people who are looking for employment. So once they obtain data for each of these indicators, they do a series of calculations to reach one composite gender inequality index score for each individual country that they're looking at in the Human Development Report. So this score ranges from 0 to 1, and with a perfect score of 0, meaning that male and females are completely equal in that country based on the indicators that they're measuring. And then a score of 1, meaning that females and males are as unequal as can possibly be in that country. So how did we use this to look at the association between gender inequality and dating violence? So the first thing we decided to do was that the U.S. states would be used as the unit of analysis. So we were not looking at individual reports of dating violence. We were looking at those state prevalence rates and comparing those to the measure of gender inequality in each state. So again, physical and sexual dating violence victimization was measured using the Youth Risk Behavior Survey. And as I've already talked about, they added that sexual dating violence survey item to the survey just in 2013. So we were really lucky to be able to look at both of those. But I do want to point out that the user risk behavior survey does not measure perpetration, so we were only able to look at dating violence victimization in this study. So then again, gender inequality was measured using the Gender Inequality Index. And the biggest caveat with that is that the UN Development Program, they only calculate the index for countries. So what we had to do was find data sources that were comparable to what they'd use to calculate it for countries and make our own calculations for each state in the US. So for most of these indicators, we were able to find some really good, reliable data from things like the census or from vital statistics. But maternal mortality was a bit of a challenge because it is measured so differently in each state. And I won't get into the details of that. But just suffice to say that we didn't really feel confident that the measures for each state were going to be reliable. So what we decided to do was take the maternal mortality rate for the U.S. as a whole and plug that into each state's calculation of the index. So then once we had all of our data together, we used Pearson's correlation coefficient to measure the association between gender inequality and dating violence. So basically what we just wanted to see is if higher scores on the index in states would also be associated with higher rates of dating violence in those states. And then,
I'm sorry.
Yeah,
so
go ahead.
I just want to get a clarifying question. Someone's saying,
Sure.
can they? Is there a tool? Is it a publicly available tool to determine the inequity in their country, in their county, city, or state? Sounds like it's a complicated process and not an easy tool.
It's not a super easy process. It is possible. So the Human Development Report does publish the formulas that they use to calculate the rates. They are, I will put out a warning, they are a little complicated. And then the next trick is finding data sources that are comparable in reliability and consistency to the ones that they use to calculate it for countries. So it is challenging, but it can be done. I mean, we did it using all publicly available data, so it can be done. All right, so that was a great question. But so we used Pearson's correlation coefficients again to determine the strength of the relationship between dating violence rates and the Gender Inequality Index. And then we also went a step further to look at and see if there was any relationship between dating violence and the different indicators of the Gender Inequality Index. So before I do get to our findings, I just wanted to put this up, and this will answer people's question if they're curious about the Gender Inequality Index for their own state or for any other states. This is the Gender Inequality Index score that we calculated for each state, and they are organized from lowest to highest. So again, a lower score of the Gender Inequality Index means that that state is more gender equal, and a higher score would mean that that state is more gender unequal based on the Gender Inequality Index. So you can see that Vermont is the lowest with an index score of 0.18, and Oklahoma is the highest with an index score of 0.33. And I also wanted to point out at the top of the screen that we calculated the Gender Inequality Index for the U.S. as a whole, and that number is 0.26. And that is actually the same number that the Human Development Report calculated. So we felt, after that, we felt pretty confident that our calculations were parallel to those that the Human Development Report used. Okay, so now let's get to the results. All right, so, yeah.
Quick question, because I've never had this in a Prevent Connect web conference before. Mary asking the question of what's the standard deviation, just to get a sense of how much deviation you expect.
I don't have that right in front of me. I can certainly get that information to you after. It is in the paper, but I don't have it right in front of me right now. I'm sorry about that.
That is fair to do.
Okay. All right, so here are our results. So on this slide, you can see we have a correlation matrix. And basically, just to break this down, if you're not familiar with correlation matrices, basically the numbers here show the strength of the relationship between the two variables that intersect at that point. So for each number, you'll have a variable in the row and a variable in the column. And where those intersect, that number there shows you the measure of the relationship between those two. And basically, a correlation can range between 0 and 1, with anything closer to 1 or -1, meaning that the relationship is stronger between those two variables. So as you can see at the top, we have the different aspects of dating violence. On the left, we have physical dating violence, and on the right, we have sexual dating violence. And then each of those are broken down so that we have total dating violence, which includes both males and females, and then we break it down by gender for each one. And then on the left, you can see the rows each represent, the top row represents gender inequality index, and then each of the subsequent rows represents the different indicators of the index. And again, we didn't include maternal mortality because it was just a constant for all states, so there was no relationship between that and dating violence. So the most important part of this, of course, is the top row, which I've highlighted here in purple. And as you'll see in the circle, that is where you can see that the gender inequality index is significantly related with female physical dating violence victimization. So no other types of dating violence were associated with the index. But I do want to draw your eye down a little bit further and see that two of the indicators were actually also associated with female dating violence victimization. The adolescent birth rate was associated with female physical dating violence victimization and total physical dating violence victimization, and educational attainment. So looking at female educational attainment versus male educational attainment was associated with sexual dating violence victimization for females and for all females and males. And I'm not going to talk about the indicators as much, but I'm going to talk a little bit more about the main finding, which is the association between the gender inequality index and physical dating violence victimization. So based on the significant association between those two, we just wanted to map them out just so we could visualize the relationship a little bit better. So as you can see here, there's definitely some regional similarities between the two variables. So both gender inequality and female dating violence victimization are definitely concentrated. The higher numbers are concentrated in the southern regions. So now that we have the statistics and we know what the correlation is between them, what does this really mean in plain language? So at its most basic level, this just means that our study found that states with higher levels of gender inequality based on that score that we obtained are associated with higher rates of physical dating violence victimization among female teens specifically. And so although we know this has been demonstrated among adult women somewhat, this really does extend our knowledge of the relationship between gender inequality and violence against women, and it extends it to explore it more among teens. So more importantly, what does this mean for prevention? So first, this study aligns with research that has found a relationship between gender stereotyping and dating violence at the individual level. So as you may know, there are programs out there like Safe Dates and 4th that actually address gender stereotyping in trying to prevent dating violence. So we think that this study supports programs that do things like that, and it may even suggest that gender inequality is one of those things that may influence people to maintain those gender stereotyping beliefs. Of course, we don't think that a society with gender inequality is the only thing that influences those beliefs, but it may be one of the contributing factors. So also, this study suggests that maybe societal level interventions that address gender inequities may positively affect dating violence, and they may help prevent dating violence. So on the right is just an example of one such effort through a 2013 presidential memorandum that intended to better coordinate our policies and programs that promote gender equality. So we think this study really points to examining more closely societal efforts to promote gender equality and see whether those efforts are actually related to dating violence prevention. And finally, we recognize that the findings of the study are pretty preliminary because this is really the first time that gender inequality has been examined in relation to dating violence. But we do think that these findings can really be a starting point for examining gender inequality a little bit further, and then for also evaluating the effects of policies and programs that address gender inequality and evaluating their effects on dating violence. And we also think that this study could be a model for studies that want to look at other societal influences on dating violence. So just as an example, on the right is, or on the left, I'm sorry, is the health impact pyramid. And this was created by CDC's director, Tom Frieden. And it shows you that the further you move down the pyramid in terms of the types of interventions you're implementing, your population level is going to increase, while the effort of the individuals that you're trying to reach, their effort to change their behaviors is actually going to decrease. So if we begin to turn our attention to these socioeconomic factors or other macro level factors that may influence dating violence, it's possible that we could increase our impact while also decreasing our efforts that we need to influence individual behaviors. So of course, I would be remiss if I didn't point out some really important limitations of this study. So first, this study included high school students only, so it misses an important population of students who have dropped out of high school or who are absent a lot and who just weren't there the day the survey was administered. And then second, as I already mentioned, some of the states did not report, either didn't participate in the YR, or the Youth Risk Behavior Survey fully, or didn't report data for this particular survey item. So this actually made our sample size a little bit low. Our sample size is 38 states for the physical dating violence question and 31 states for the sexual dating violence question. So it's possible that there were some other relationships there that we just weren't able to determine because we didn't have the statistical power to do so. And then third is probably the most important. This is that we did not control for any potentially confounding factors. So there's an old saying that correlation doesn't mean causation. So just because we see an association here doesn't necessarily mean that one is causing the other. But again, we really do think that this study is a starting point for looking at gender inequality and that there may be some influence that it does have on dating violence. And then finally, as I mentioned, maternal mortality was a constant for all states when we calculated the gender inequality index. So once maternal mortality data is more consistently collected among the states, I think it would be really interesting to look at how that affects the gender inequality scores, index scores, and then how that's related to dating violence. So that is all for me. So I'm going to turn it back over to David and see if he has any questions for the audience about how this could potentially impact your work.
David, are you there?
I'm sorry, I was on mute. I was unmuting the phone, so now I am back here. So I want to get a sense from the audience, to hear from the audience a little bit about what they want to be able to think about of what are some of the ways that you think you might be able to do prevention work that's going to be going on, and maybe some novel approaches to looking at the society level. Because this is exciting because it suggests the possibility of looking at gender inequity on a societal level as something that's which I think has been aligned with a lot of how we've been thinking, but this now gives us a stronger sense of that's something that we need to be exploring further. So what are some potential activities that people can do? Someone said use of the World Peace Game. I do not know what the World Peace Game is, so Diana, if you can write a little bit more about that, that would be helpful because I do not know what that is. What are some ideas about doing work on the societal level or novel approaches that you might be able to do to look at gender inequity that might be useful for us to be able to do this? So I'd love to hear more from our audience. What are some of the things that are coming to your mind? Leslie talks about gender equality social norms campaigns for communities. And so we're really doing these campaigns, letter writing to local, state, or federal politicians. Anti-oppression and equality work becomes something that is clear. Faith, can you say what VBAC? I will admit I do not know what that is. So let's go ahead and media campaigns on gender role. Denim Day is a campaign that people are doing. Pure Education, campaigns through social media. Vaginal birth after cesarean access, and how that affects gender equity. So this shows about ties to other health outcomes. So there's sounds like Diana's talking about a game, so that people can be able to do that. It's 4 levels of the world that you set up, having people look at problem solving on a societal level to improve the world as a whole, and get students to act together playing different roles. If they practice doing things correct, that can help. So it's just a way that be able to think about how we can be able to create those changes. And while we still need more research and learning more, and as you said, Lindsay, this is a correlation, it's not causation. It does, there is evidence, we do see that this correlation is something that does exist across many different societies. So thank you all for sharing, and thank you, Lindsay, for that really great presentation. So I'd like to now bring Renee Johnson, who from Johns Hopkins Bloomberg School of Public Health, talking about neighborhood context and dating violence among adolescents. So Renee, take the podium.
Hi, everyone. Is the sound okay?
Perfect.
Okay, great. Today I will be talking about neighborhood context and adolescent dating violence. So just to start out, I wanted to remind you all that adolescent dating violence is a fairly new field of inquiry. Although advocacy work has been going on for quite a while with young people, the first research papers on adolescent dating violence weren't until the 1980s, and the first national estimates weren't available until the early 2000s. So this is still a field that is pretty new. In a review by Kevin Vogge, he looked at correlates. He and his colleagues looked at correlates, and they identified important risk factors for dating violence at multiple levels, including the individual level, the peer, and the family level. What we found was that there was little research conducted to assess factors at the outer levels of the social ecology, including neighborhood. And I think this is unfortunate because characteristics of neighborhoods that may influence relationship violence. Young people initiate relationships in their neighborhoods, and the context could impact how they're supported. So today I will be talking about what's known about the neighborhood context of adolescent dating violence. So a premise involved in the work I'm going to talk about today, and I think in general, probably what Dr. Grisson was talking about before, is that what is happening in larger society impacts health. Sometimes that's hard to quote unquote model or statistically assess. And when I'm saying modeling, I just mean put into some formula to understand how one factor is related to another factor. So if you think of the social ecological model, as you go out to the outer levels, the more distal levels, the measurement and modeling gets a little harder. It's harder to link a structural factor like gender inequality to an individual factor like dating violence, because there are more possibilities about what caused this violence at all these different levels. But we're still going to push forward, and I'm glad that we are. Okay, so I'm saying larger societal factors impact neighborhoods as well as people. Structural factors such as globalization or the loss of manufacturing jobs in American cities impacts the number of jobs that are available here in the U.S. and in specific cities within the U.S. Think about where you're from. You're from lots of different places. There are different levels of joblessness in different cities, and a lot of that is because of changes in manufacturing. This also impacts the level of unemployment. So this type of an approach where we look at large structural factors and then link them to individual behavior, it's called structuralism, if you're interested in the title. Okay, so globalism, as an example, is a phenomenon that impacts neighborhoods and may result in things like joblessness and higher levels of poverty in a specific neighborhood. It may also affect people leaving the neighborhood en masse. such as in Detroit after General Motors left, and result in social phenomena like large amounts of vacant housing. That's a problem in the city I live in, Baltimore. Social processes are also impacted. So with higher levels of poverty and out-migration from neighborhoods, schools have less funding, and that's because schools are primarily funded by housing. So there may be fewer teachers to invest in youth, and there's a net loss of human capital for young people. Also, I'm just talking about different ways that structural factors might impact neighborhoods. This is by no means exhaustive. But in neighborhoods with higher levels of joblessness, people are less likely to get married, but they're not any less likely to have children. So there's a likelihood that there'll be more households with a single parent versus two parents. So there may be less capital, human capital, for young people in the family setting. So neighborhood context and social processes impact behavior. We know that for other topics. For example, school performance, interpersonal violence. There's a large body of literature looking at neighborhood factors and chances of graduating from high school. The question I wanted to ask myself in the paper that I'm talking about today is, could these neighborhood factors also be associated with dating violence? David's question to the group was, what are the challenges to implementing community and society-level interventions to prevent adolescent violence? What should we be doing? And I think that one challenge is that we don't know the best thing to do because we don't know what is related to what and what those mechanisms are. So I think that if neighborhood factors are associated with dating violence, then we can think about what structural factors impact neighborhoods and which social processes mediate the Neighborhood Dating Violence Association, and from there develop appropriate intervention strategies, either behavioral, policy, or both. So before I talk about the results of the paper, I just wanted to talk about how we classify neighborhood factors. And the first box, the red box, is demographic and structural factors. This may be what you think of primarily when you think about neighborhood factors. The definition is summary features of the social and organizational structure and composition of a neighborhood. Some examples are population characteristics, such as level of home ownership, number of residents living below the poverty level, number of vacant housing, any kind of demographic composition of the community. And these things are usually measured from using data from the U.S. Census. And as we talked about in the previous slide, these factors are indicators of what's going on structurally and also impact individual behavior. So they really relate and reflect social processes and resources at the neighborhood level. In that second box, the green box, is neighborhood disorder. And this can be defined as a lack of order and adherence to conventional social norms in a community. There are two types of neighborhood disorder. One is physical disorder, and this includes phenomena like high levels of vandalism, rodents, litter, vacant housing, and trash within a given community. And social disorder reflects obvious and public levels of violence, sex work, drug selling, drug use, and other incivilities, like being loud. So broken windows theory relates to neighborhood disorder, and what this says is that in neighborhoods with high levels of social disorder, it communicates to residents and people there that no one is in charge, and it invites criminal behavior. So just think about the example of littering and how likely you are to litter in any given environment. If you were at a beach with lots of trash and soda cans and old flip-flops or things like that, you would be sad, but you might also be much more likely to litter on that beach. Whereas if you went to a pristine, beautiful beach with not one piece of litter, you would clearly know this is not a place where you litter. So that's where the broken theories window comes in. In terms of measurement, So in some aspects, it's difficult to measure neighborhood disorder. What people usually do is administer surveys to residents asking about perceptions. For example, they might ask, how big of a problem is vandalism in your neighborhood? Now, this is subjective. So within the same community, person A, person B, person C, and so on are going to respond to this question differently. And this makes kind of understanding the research findings difficult. Another thing that makes measurement difficult is that there's no one survey that measures neighborhood disorder. Most researchers use different surveys. So again, it's hard to compare. And finally, one way, because violence is an aspect of neighborhood disorder, some researchers look at violent crime rates. And that's a nice way to get at something subjective because it will be from the police or from police data. So that's one option, but it's not frequently done. And then finally, the purple box is social disorganization. This is defined as the ability of a community to realize common values and address common problems. Social disorganization is an old concept dating back to early work in Chicago in the 1900s. But within the past couple decades, it's been reconceptualized by Sampson and Earls as collective efficacy. So they presented a kind of an updated definition, which is an updated definition and a 10-item scale for measurement. And their tool is widely used in neighborhood research, particularly in the health field. Two important concepts within the concept of collective efficacy are social cohesion, and that's defined as shared values among neighbors. And it addresses things like, do you like and enjoy your neighbors? Do you share similar values? Do you feel supported by community members? And things like that. The second concept is informal social control. And what this is really getting at is willingness to improve the whole neighborhood. So examples are supervision and monitoring of youth. If two young people got into a fight on a street, would an adult take notice? Would an adult take action? So I just want to reiterate that control, this is not control in the sense of an abusive behavior, but more in the sense of recognizing and addressing behavior that does not conform to group values, such as violence. So informal social control is as much about reinforcing positive behaviors and pro-social behaviors as it is about discouraging negative behaviors or antisocial behaviors. So with that as background, I'll talk about the study that we did. And before I do, I just wanted to give you an example. I'm saying mechanisms. So if you think about one factor being neighborhood factors and the outcome variable being dating violence, it's hard sometimes to think about, like, how did we get from one place to another? And neighborhood violence is a very common aspect of neighborhood disorder. And so just to give you an example of how I might think about mechanisms, neighborhood violence, what does that do in the minds of young people? It disrupts the development of empathy. It increases anger and frustration. It normalizes and disinhibits violent behavior. It desensitizes youth to violence. And it teaches youth to respond to perceived provocations with violence. So what we're saying here is that neighborhood violence, which is an indicator of neighborhood disorder, there are some clear theoretical pathways that we could understand how that might impact dating violence. So now I'll talk about the paper. And before I get started, I just wanted to acknowledge my co-authors who worked very hard on this paper with me: Elizabeth Parker, Jenny Reinhart, Jennifer Nail, and Emily Rothman. So we conducted a systematic review of the existing research literature to summarize what is known about the association between neighborhood context and dating violence. We reviewed all of the articles published since 2005 that presented a measure of association between a neighborhood factor and dating violence. And a measure of association is simply a statistic telling us the extent to which two variables are associated beyond what would be expected by chance. So the correlation coefficients that Dr. Grissard presented, they were measures of association. Because young people and adults are different, and the way that violence happens in partnerships among those two populations is different, we focused just on those younger than 25. There were only 20 studies after an exhaustive review, and most of those focused on physical dating violence. So from the start, it's clear that we actually don't know a lot about neighborhood context and dating violence. So now I'll talk about what we found. The first aspect, we looked at those articles that looked at demographic and structural characteristics in dating violence. And recall that the definition for this classification is features of the social and organizational structure and composition of a neighborhood. There were only 11 studies that looked at demographic and structural characteristics in DV, and there was insufficient evidence to suggest an association between neighborhood level characteristics and dating violence. The problem wasn't so much that these studies showed that there was no association, but rather that they just really weren't designed to answer this question. Rather than being the primary focus of the study, demographic and structural characteristics were a little bit of an afterthought thrown into or put into a statistical model after factors that would have a stronger impact on dating violence were already there, such as child abuse as a young person. So as a result, the studies weren't designed to answer the question that I am interested in, and we really don't know about the association. So this is an example where more research would really tell us a lot more information. Then the second area we looked at was neighborhood disorder and dating violence. And again, neighborhood disorder is defined as lack of order and adherence to conventional social norms in a community. We found about 12 studies, and about half of them showed that low perceived neighborhood disorder is protected for dating violence. So what this means is that if a person reports that their neighborhood has low levels of neighborhood disorder, they're less likely to engage in dating violence as a victim or a perpetrator. There's an important caveat to this, however, and that is people engaged in violence are probably more likely to rate their neighborhoods as more disordered. So forget violence for a second and think about depression. If there's a depressed person asked to report about how cheerful people are in the neighborhood, that person might be more likely to say people are not cheerful. This is called a same-source bias, and there's it's real hard to disentangle truth when there's an important bias. So this is a real research limitation, and we need some studies that use different methodologies, for example, that look at violent crime rates or that look at objectively measured neighborhood disorder, which we can talk about in the question and answer period, what that might be. Okay, and finally, collective efficacy in dating violence. Collective efficacy is defined as the ability of a community to realize common values and address community problems. There were 8 studies that looked at this, and nearly all showed that high levels of collective efficacy is protective for dating violence. And what's even better, that gives us a bit more confidence in this research, is that most of the studies use the Sampson and Earls measure that I talked about before. So there's consistency in measurement. However, there is the research limitation remains that reporting on collective efficacy is a subjective process, and people will vary in how they report on their community. Okay, so in summary, there's limited evidence linking specific neighborhood factors to dating violence. However, we do know that neighborhood factors impact interpersonal violence among adults, and we do know that neighborhood factors are associated with intimate partner violence among adults. So there's reason to keep looking, but we need more studies with more rigorous methods and probably better theory. We need to think more about the mechanisms by which these neighborhood factors might impact dating violence. But because you're a practitioners, I really wanted to end with some questions about how can neighborhoods be provided with the support they need to discourage violence and promote healthy relationships. And I have 3 things for you. 1, efforts to reduce physical disorder may decrease dating violence. I think Emily gave some examples of this. But there's also an example in Philadelphia where they greened, meaning cleaned up, got all the litter out, redid buildings in Philadelphia, and found a drop in shootings. 2, community-level violence prevention efforts may impact dating violence. So this means that you don't have to do something specific. There may be something going on, and you could add a little bit of DV prevention in there, and that might impact things. And then finally, strengthening collective efficacy in community ties and increasing supervision of youth may actually prevent DV. So if we continue to work in communities and remind adults that they're important and important sources of human capital for young people, that may make a difference. Thank you.
Thank you, Renee, and this sort of makes me think of what we often talk about here at Prevent Connect. A good solution may solve multiple problems, and that we, by being able to address some of the community-level violence issues, having an impact on dating violence, and you're using dating violence, right, Renee? DV to represent dating violence from this study.
Correct.
And I think Emily had also noted that in there. Well, thank you very much. I really appreciate your that presentation. I'm really raising a lot of questions and a vocabulary, I think, for us to think about as we look at neighborhood levels. And I think there's so much levels that we can be looking at this on the neighborhood level. So that was really very helpful. Thank you, Renee. And we're going to continue now with Luz McNaughton-Reyes, who's going to talk about the social context influencing substance-related dating violence. And Luz, great. This is an important topic, and sometimes one that gets a little, when we talk about dating violence and substance use, we get aware of some cautions that can happen. So maybe, Luz, we should start by exploring a little bit of how sometimes that conversation, if not held thoughtfully, can be problematic. So why don't we start with the question, Luz, before Luz begins, just what are the challenges when we talk about alcohol and substance use and dating violence? I'd like to just hear from the audience. What are some of the challenges that when we have this conversation, it's important that we have this conversation, but we have to acknowledge what some of those challenges are. So I'd love to hear from the audience here on that. What are some of those challenges that they see? So let's go ahead, and oops, I put that on the top of there. I'll put it into the text chat too. And then this is a question of there's the role, does substance use cause domestic violence? Alcohol becomes an excuse to deny the choice of the behavior. It's a lot of the excuse piece. Sometimes it's focusing on preventing victimization rather than perpetration. And that, that there's sometimes that there's other reasons for dating violence other than alcohol and drugs. And what we don't want to do is put the fault on the victim. And so to be able to do this. And so there's separate issues, and that we want to look at separately, but we also have to look at that overlap, because that overlap is something that's there. And sometimes people don't consider alcohol to be a problem in different situations. And so I see lots of conversation of we don't want to interpret this as victim blaming, and that's an important piece. And we need to recognize that many people self-medicate when they've been abused, and alcohol is widely used. It's a common social norm. But then alcohol can enable heightened risk factors, Jessica points out. So, Luz, we see a lot of these questions that come up. Anything you want to say about the challenges, Luz?
I'll get into it when we start, if that's okay.
That'll be great. So let's ask another question of our audience. So what do you see, given those key caveats, what do you see as the links between substance use and dating violence? So let's talk about what are those links that you do see. And that I think that's important to be able to, so societal norms might be a piece, power and control, the trauma that can be associated with this, and that I think there's lower inhibitions that then, so that's something in particular when we're looking at the perpetrating behavior. So as our audience, lack of parental support, perpetrators may force victim to take or sell drugs. Victims blame themselves because they were drinking. Impact of trauma leading to possible use of substance as a coping mechanism. Maladaptive coping, so I see a lot of coping pieces. The secrecy of drinking will lead to the secrecy of what can happen under the influence, and then become a barrier to being able to do help-seeking behavior. And similar, because they might not want to come forward because they might be underage, and so victims, if they were involved in drinking. And so I think we talk about the question of alcohol causing, and it was their fault, and and then some sort of this myth that if both parties were drunk, then it wasn't domestic violence or sexual assault. So, Luce, with that, why don't you talk? I'm going to pass the podium over to you and talk about what you see as the linkages and talk about your study and what questions this raises for us.
Thanks, Dave. If you don't mind, I'm just going to go back to the, can I move the slides or no? Can I move backwards or no?
Absolutely.
Okay. All right, it's not letting me.
I just did it for you.
Okay. Yeah, if you go back to the very first slide. Thanks. Thank you so much. Okay. Perfect. All right, so thanks, David. First of all, I would just like to say thank you to Prevent Connect for hosting this, and to all of you all for all of your fabulous work. You all deserve a big thank you from us researchers for doing what you do. And I'd like to acknowledge my co-authors on this paper, Drs. Foshi, Ennett, Tharp, and Bauer. This study that I'm going to talk about today is about the influence of the role of social context in influencing substance-related dating violence perpetration. So the focus here is on substance use and dating violence perpetration, not victimization, and the role of social context in working together with substance use to influence dating violence perpetration. So in contrast from the previous studies that, in the case of Lindsay's that focused on victimization and Renee's that focused on victimization and perpetration, mine is focused on perpetration. And in terms of the social context I'm going to be talking about, rather than just talking about neighborhoods, I'm going to be talking about neighborhoods, the family context, and the peer context. And I'm going to be focusing on how our social context, our environment, can make a difference in whether an individual risk factor, such as substance use or substances such as family violence or child maltreatment, will influence dating violence perpetration or not. So relationships at the individual level may work together with our context to influence the likelihood of a particular behavior. All right. I'm not sure why, David, but I can't move the slides. Do you mind moving forward back to where we were? Thank you. All right. So this study, I'd like to acknowledge all of your comments about the different linkages between substance use and dating violence, and just say up front that this study took the perspective, which is based on a lot of experimental research, not with adolescents, but with college-age students and adults. Obviously, we can't do experimental substance use research with adolescents because substance use is unlawful for them, including alcohol use. But there's a lot of experimental research that suggests that substance use intoxication influences how we think. It influences our brain function. So it can influence our perceptions of what is happening around us and our ability to inhibit inappropriate responses, such as aggressive behavior. Intoxicated individuals may retaliate strongly when they feel threatened, and once they begin behaving aggressively, they may not perceive cues that tell them to stop. And there's some experimental research that suggests that the way that intoxication works is that it can lead to sort of nearsightedness or myopia, whereby you are focusing only on the immediate and forgetting about long-term consequences of behavior. And that can facilitate aggression. But also the research shows that many, many, many individuals who engage in substance use, be it alcohol use, marijuana use, hard drug use, do not perpetrate violence. So the fancy research word that we use for that is called heterogeneity. We see some studies where there is an association, some studies that show a weaker association. So that has led researchers to try to think about this relationship as actually being something a little bit more complicated. Move forward, David, if you will. And the hypothesis that we explored in this study is that the link between substance use and dating violence perpetration may be moderated by or conditioned by or depend on social contextual factors. So it may depend on our neighborhood environment, our family environment, our peer environment. Okay, so the idea here is that substance use intoxication may have certain effects on the brain that facilitate aggressive behavior. That's depicted by the blue arrow going from the substance use picture to the dating violence picture. But the factors in our social environment, including neighborhood, family, and peer level factors, may interrupt this pathway, making it less likely that substance use will lead to abuse, or they may strengthen this pathway, making it more likely that substance use will lead to abuse. So what aspects of our social environment may work to condition the effects of substance use on dating violence perpetration? Move forward, David, if you will. One sort of broad category of factors that we looked at we called contextual social control, and Renee talked about the definition of social control in her presentation. And you can think of social control as including rules, sanctions, and reactions of others, such as praise, that encourage pro-social norms and discourage antisocial norms. So essentially, it's to the extent to which your social environment constrains you from being involved in antisocial behavior, such as dating violence perpetration. So the example that Renee gave is at the neighborhood level would be if community members actively intervene to prevent kids on the playground from fighting. That would be an example of neighborhood social control. An example at the family level would be parent rule setting and monitoring of adolescent behavior. And we've hypothesized that context, neighborhood context, family context, peer context that promote social control, so promote pro-social norms and discourage antisocial behavior, would weaken the influence of substance use on dating aggression. Okay, so we thought that when adolescents are using substances, they would be more likely to report dating violence perpetration, but that association might be weaker or even non-significant for adolescents nested in environments that were high in social control, as compared to adolescents who were nested in environments that were low in social control. Go ahead, David. The other category of factors that we looked at we called contextual violence. And so teens who are exposed to peer, neighborhood, and or family violence may come to view such behavior as acceptable, as Renee talked about in her presentation. So we hypothesized that contextual violence may strengthen the influence of substance use on adolescent dating violence perpetration. So we hypothesized that when adolescents use substances, they would be more likely to report engaging in dating aggression, and that relationship would be stronger if they were nested in violent family, peer, or neighborhood environments. Go ahead, David. So these are just two graphs sort of depicting our two broad general hypotheses. And in both graphs, on the x-axis is substance use going from low to high, left to right. And on the y-axis is frequency of dating violence perpetration going low to high, bottom to top. The graph on the left-hand side of the screen depicts our hypothesis about contextual social control. So we hypothesized that increases in substance use would be associated with increases in dating violence perpetration. So the association depicted by the white line goes up as substance use goes up. But that association would be weaker or even non-significant for adolescents in high control environments compared to those in low control environments. And the graph on the right-hand side, which follows a similar logic, depicts our hypothesis about contextual violence. So we hypothesized that increases in substance use would be associated with increases in dating violence perpetration. So again, the association, the white lines go up as substance use goes up, but would be stronger for adolescents in the high violence environments compared to those in low violence environments.
Yeah. Luz, can you speak just a little bit? I'm sorry, Luz, can you speak just a little bit louder, please?
Sure. I'll put the phone closer to my mouth. Sorry.
Great. Thank you.
Okay. Move forward, David. So to test these hypotheses, we use data from a longitudinal support study, a school-based study of adolescents using surveys who were enrolled in all the public school systems in two predominantly rural North Carolina counties. We collected 4 waves of data that spanned grades 8 through 12. It was a very diverse sample. 47% of the adolescents in the study identified as Black or African American, 48% were male, and 40% reported that the highest education obtained by either parent was high school graduate or less. And we used multi-level modeling to assess the influence of substance use and these contextual variables and their interaction on trajectories of dating violence across grades 8 through 12. Okay, move forward, David. So to give you a sense of our measures, the outcome we looked at was physical adolescent dating violence. The acronym ADV in my presentation refers to adolescent dating violence perpetration. We looked at 3 substance use variables, heavy alcohol use, which included such indicators as having 3 or 4 drinks in a row, having gotten drunk, having been hungover, marijuana use, and other hard drug use, which was a self-story. Our contextual variables, we had measured parent and monitoring.
Your voice is sliding away. Can you make sure you stay close to the phone?
Yeah, yep, next to me, sorry. At the peer level, we had a measure of friendly beliefs and social values, and at the neighborhood level, a measure of social cohesion. Then we also had 3 measures of sexual violence at the family, peer, and neighborhood levels. Okay, move forward, David. All right, so these were our results. Overall, consistent with our hypothesis, we found that associations between substance use and dating violence perpetration were weaker or non-significant when adolescents were nested in neighborhood and peer environments characterized by high levels of social control. So the graph here tries to show this pattern of findings visually. So here, the vertical axis represents the effect of heavy alcohol use on dating violence perpetration. So a stronger effect of heavy alcohol use on dating violence as you move up the vertical axis. And the horizontal axis shows how this effect differs depending on whether the neighborhood social control is low or high. So at low levels of neighborhood social control, there is a strong effect of heavy alcohol use on dating violence perpetration. And it's statistically significant, which you can see by the error bars in the graph, which don't include 0. But at high levels of social control, there's no significant effect of heavy alcohol use on dating violence perpetration. And we found this moderating effect for neighborhood social control for all 3 substance use variables, so for heavy alcohol use, marijuana use, and hard drug use. Move forward, David. Also consistent with our hypothesis, we generally found that associations between substance use and dating violence were stronger when adolescents were nested in family and peer environments characterized by higher levels of violence and conflict. So this graph again provides an example for heavy alcohol use. For adolescents nested in environments characterized by low or no levels of family violence, the effect of alcohol use on dating violence perpetration is fairly weak. But for adolescents exposed to high levels of family violence, the effect is much stronger. Go ahead, David. So the prevention implications of our findings relate to are really focused on how intervening at the social context can reduce substance-related adolescent dating violence perpetration. So our findings suggest that interventions that foster neighborhood social control, so foster interactions between neighbors and youth and establish community mechanisms for supervising youth and promoting pro-social behavior, these sort of norms campaigns that you guys are suggesting, which are great, that those sorts of efforts may prevent substance-related adolescent dating violence perpetration through changing the context. That interventions to promote pro-social values and anti-violence norms in peer networks, so within friend networks, could also prevent substance-related dating violence, and particularly alcohol use-related dating violence perpetration. And that interventions that prevent or reduce family violence could also work to prevent substance-related dating violence perpetration. So those are the prevention implications that we found. And with that, I tried to go fast so that we would be done by 3:30. How did I do?
Sorry, you did very well. I appreciate it. We don't have enough time for our next question, which was what are the implications, but we will be asking that in our evaluation of what's the next step you're going to take to be able to do taking these pieces. I think it was really interesting to look at the place of that context. So I do want to let you know that you can contact each of everyone here, and we do have their email addresses available on this slide. This is also on the Prevent Connect website, and really encourage you to be able to think more about the neighborhood pieces. And I think that this research really provides the direction. I want to really thank all of you for what you're able to do. We will be doing a recording of this, and it will be available probably in the next couple days. So this is something that other people can watch. If you have colleagues that you want to be able to share, this was a very helpful, important context. So with this, I'm going to thank all of you for joining us on today's Prevent Connect conference. I want to really thank all of our speakers. Thank you, Emily. Thank you, Renee. Thank you, Lindsay. And thank you, Luz, for joining us. And most of all, I want to thank all of you in our Prevent Connect audience for the work that you're doing and your contributions to participating in this discussion as we continue to look at how we can make social changes that can lead towards the prevention of dating violence, domestic violence, and sexual assault. So with that, I will keep the text chat open for a few minutes, but this will conclude the audio portion of today's Prevent Connect web conference. Thank you, and I look forward to seeing you at a future Prevent Connect web conference. Have a good day.